Welcome to another episode of Chill with Bill at San Antonio Zoo. And today we have Dr. Morgan Kallenberg. He's a surgical oncologist and chair of cancer services for the Baptist Health System. So how are you today, Dr. Kallenberg?
I'm doing well. How are you?
Doing great.
Good.
We're here at the jaguar habitat. And did you know the jaguars can actually get breast cancer?
I did not.
So Dr. Kallenberg, tell me about the prevalence of breast cancer in our community.
Well, our community, along with other communities in the country, recognize that breast cancer is the number 2 cancer in women, with close to 200,000 new cases nationally every year. So very, very prevalent, and it's certainly at the top of our radar every year.
Dr. Kallenberg, are there risk factors associated with breast cancer?
There certainly are risk factors. One, and I know it's intuitive, but female sex. Breast cancer does occur in males, but it's about a ratio of 100 to 1, female to male. Age, we see the peak incidence between 65 and 79 years of age. Family history, very, very important. It may not be something that's genetically inherited, passed down, but it certainly can be, and that's the minority of patients. Things like obesity has both risk factors, along with in women who have breast cancer, is a risk factor for things like recurrence, decreased survival, diet, exercise, all play a role. So high red meat, high saturated fat seems to be a risk factor. So healthier diet, exercise, and be protected.
Is there any way to screen for breast cancer?
Absolutely. Mammogram, as I hope many of the viewers, if not all the viewers, have heard of, plays a very, very central role in screening for breast cancer. Starts at age 40 in individuals who what we call are at average risk, people with family histories, people with genetic inherited patterns need to start earlier, and then self-breast exams are also very important.
Dr. Kallenberg, if a patient is diagnosed with this during a mammogram screening, what happens? What's next? Is there somebody to help them, navigate through it?
Absolutely. So for women who go for screening mammography, if the screening mammography is abnormal, there's callbacks, more views, sometimes biopsies occur, and that's where the diagnosis is made. And it's important for women, friends, family to understand that this is not a walk that you take alone. The Baptist Health System provides for navigation, which are basically registered nurses who dedicate their careers to hand walking patients through that healthcare continuum. They're experts in breast cancer. They're experts in the multi-disciplinary approach that comes to treatment. And that's something that's available right out of the Baptist Breast Network or the Baptist Breast Center at North Central Baptist.
What are some options for treatment for a patient who has breast cancer?
Well, treatment is multifaceted, multidisciplinary. So for patients with early stage cancer, it most always involves surgery. It also includes care by a medical oncologist in the form of things like hormonal blocking therapy, chemotherapy, immunotherapy. Radiation oncology plays a role also. So the key thing to understand for patients and family members is it's multidisciplinary and very much personalized. And that's something that we strive to achieve through the Baptist Breast Network, through the Baptist Breast Center.
Are there any special accreditations for the Baptist Health System related to cancer?
There are. So we have, I think for over 20 years, been accredited through the foremost accrediting body nationally, and that's the Commission on Cancer. And it takes a significant amount of dedication and work and, frankly, high quality care to achieve the accreditation by the Commission on Cancer, which is through the American College of Surgeons. And from a timeliness perspective, there are a handful of centers that are being recognized for the excellence in cancer surgery care. And the Baptist Health System recently received that certification of excellence for breast and other cancer surgery care.
Dr. Kallenberg, what does it take to be a surgical oncologist?
Well, it takes a fair bit of training. General surgery, for example, is where we start, and that's 5 years of training after 4 years of medical school. After that, if you decide you want to become a surgical oncologist, it's an additional 2 or 4 years of training. So a total of 9 postgraduate years of training. And something that clearly separates the Baptist Health System, the Baptist Network for Cancer Care, is a very personalized approach to helping a patient through the continuum of care, from diagnosis to care, and then to something that we call survivorship, which is the light at the end of the tunnel, basically a clean bill of health. And Baptist has, through navigation and through physician dedication, identified leaders in multiple areas of cancer care who have all rolled up their sleeves and dedicated their craft to taking care of Baptist patients.
Dr. Kallenberg, from a surgical standpoint, what options does a woman have for treatment for breast cancer?
There's a vast menu of options that many women are eligible for, including breast conservation, which means saving the breast by doing a simple lumpectomy followed by radiation. There's the opportunity for mastectomy. Some patients desire it, some patients need it. Even removal of both breasts, again, in the right health scenario. And importantly, the opportunity for a woman to leave the operating room, not only removing the cancer, but undergoing very sophisticated, complex reconstructive techniques that are offered at North Central Baptist and within the health system. Then very importantly, patients go to a dedicated oncology unit where we have nurses who have dedicated their careers to specialization in oncology and who have seen and helped many, many patients over the months and years to get whole and to get home and to get healthy.
Dr. Kallenberg, I know in the past it's been a situation where if there was some sort of abnormality, it could take weeks to find a diagnosis. Have you guys changed that?
We have. We certainly have, from the timeliness of mammogram to a diagnostic mammogram to biopsy. And then, as we talked earlier, through navigation to get patients into and touched by providers who can initiate and provide treatment. So we've really condensed that waiting period and organized that wait.
Dr. Kallenberg, are there specialized radiologists for breast cancer?
Absolutely. We have at the Baptist Breast Center dedicated breast imagers or mammographers who really are very skilled at providing a full menu of opportunity. People know a lot about mammography. They may not know about MRI and some of the latest and greatest techniques in mammography, tomosynthesis, 3D mammography, and that's something that the Baptist radiologists or mammographers all develop.
Dr. Kallenberg, I want to thank you for coming out and chilling with Bill here at San Antonio Zoo in the habitat for the jaguars. And I hope you don't have any of them show up in your waiting room.
I hope not either, but thank you. Appreciate the opportunity. It's been fun chilling with Bill.